Hi everyone. So we will continue our discussion with Anurans. Okay, so previously we had discussed the skin, okay, the integument of the Anurans, some of its members, okay, what are their locomotory features, external features, and um, the basics of amphibians. So right now, we will be studying more in depth with the mouth, the oral cavity, and the pharynx. So this is a continuation of the previous slide that we had from the first lesson in your finals. So most amphibians will eat almost any live food that they can manage to gulp down. Insects, spiders, snails, slugs, and earthworms form the main part of their diet. They are mostly they have acquired this, okay, the insects on their diet for most adult amphibians. Larger species like the ornate horned frog will take larger prey, maybe even a mouse. Okay, that's a big chunk to gulp. And some species are cannibals. Cases frog will eat frog. So we will start the anatomy of the oral cavity in the mouth of the frog by opening it. Okay, so we'll try to open it, the mouth, by cutting the angle of the jaw on each side so that you can see the oral cavity and the pharynx. So we will try to open the mouth of the frog. Okay, you see it in the picture that the mouth is wide open, but in toad it's quite different because it has a relatively medium-sized mouth, so that's not wide as that. So in this figure, you also have to note the large tongue on the floor of your oral cavity. The tongue is attached anteriorly, okay, and folded back into the oral cavity so that its distal bifid end lies posteriorly. Okay, so the bifid end lies posteriorly, so it's moving on top. The tongue is extended to catch insects by rotating it dorsally around its anterior attachment. So that is quite difficult to imagine because we are not frogs. And for this type of capturing the prey, okay, for instance, this image will show you a toad which is making a meal of a mealworm. Okay, so when it's ready for action, number 2, the tongue flicks out, okay, and the mealworm disappears. So the tongue is used to grasp or hold the food going to its oral cavity inside. So this another example is a frog launching itself toward the prey. So try to look at the hind limbs of this frog. So it creates an action going to a wood louse. So try to see the flipping out of the front of the mouth. So this is moving on posteriorly. So imagine the tongue flips, okay, which the boy's whistle flips open and forward because the air is being blown into it. But the tongue of a frog or toad flips out and over because muscles in the floor of the mouth push the tongue forward. Okay, the floor muscles are moving it. So for the learning outcomes, we will be examining the Anuran mouth, its mode of prey capture, and the anatomy of the oral cavity. So this is quite short discussion. So, this is an anterior view of the oral cavity in the pharynx of the frog. We have the cloaca, the vomerine teeth. Okay, these are vomerine teeth are used to hold the insect inside. The pterygoid ridge, okay, the maxillary groove, the maxillary teeth. Okay, these are the real teeth, set of teeth by in a frog. We have the floor of the orbit. The floor of the orbit is the one which is holds the eye. So when the frog has captured or acted upon a prey, the floor of the orbit also moves because the eye will help the insect to be pushed down the alimentary canals of the frog. You have the esophagus, which where the insect will pass by, or the bolus. We have laryngeal prominence, the glottis, and the tongue. So this is the anterior view of the oral cavity. So this a single row of small teeth, often easier to feel. So once you have hold the oral cavity of the frog, you can feel the small teeth on top of its oral cavity lies around the margin of the upper jaw. As described earlier, the teeth are mostly maxillary teeth, and a few premaxillary teeth are near the midline, so in the middle. The teeth lie external to the maxillary groove, which extends around the margin of the upper jaw. So the maxillary groove is extending the margin of the upper jaw, and the thyroid ridge is medial to the groove. A row of vomerine teeth is present on each of the vomers, and these teeth lie farther posteriorly, or to say on top, near the midline of the roof of the oral cavity. So what is oral cavity? A series of openings enter the oral cavity. So the choana are prominent and lie lateral to the vomerine teeth. So these choana have also a near structure. We call it the auditory tubes, which is a posterolateral openings. So auditory tubes, from the root word itself, it's more on hearing of your frog, which lead to the middle ear cavities. The floor of the orbits lies between the choana and the auditory tubes. Pressure on this area will force the eyeballs up into their open position. So the glottis is on a small projection together with the laryngeal prominence, which is formed by cartilage. Laterally on the floor of your oral cavity, on each side of the anterior end of the glottis, is a small opening in males, which is relatively larger. We call it vocal sac. These sacs are used for calling during the mating season, but are difficult to find. The entrance to the esophagus is posterior to the glottis. Probe it gently to verify that it does not. It does indeed extend posteriorly. So try to insert a probe. So break the tympanic membrane to expose the middle ear cavity. So you'll find the columella, a cartilaginous distal portion passes through the cavity to the membrane. So probe the cavity to verify that it connects the oral cavity through the auditory tube. So this is quite connected. When I try to insert a probe, it will be leading to the oral cavity. So I think that's all for the oral cavity, mouth, and the pharynx of your frog. If you have any questions, please don't forget to drop a question or comment if you don't have if you have difficulty in understanding our lesson. So thank you very much for listening, and have a great day.